Hi, class. We're doing physical activity and diabetes. I'm Ed Brick.
I'm Zach Apt, and we will get started.
What is diabetes? Diabetes is an impaired ability for the body to produce or respond to insulin. This results in raised amounts of blood glucose levels. Those diagnosed tend to have a higher BMI, body mass index, higher insulin resistance, and reduced physical fitness. As of 2012, 171 million have had diabetes worldwide. 23.1 million people alone in the U.S. have been diagnosed with diabetes.
As for the types of diabetes, there's type 1, which happens when an autoimmune system destroys pancreatic beta cells, resulting in an insulin deficiency. Basically, there's not enough insulin that is able to store the glucose. This is usually genetic, and nothing can really be done about it. About 5 to 10% of cases are type 1 diabetes. As for type 2, this happens after a progressive loss of insulin release. So basically, it's not an insulin deficiency, it's just too much glucose in the blood for the insulin receptors to manage. So this can be developed through bad diets, sedentary lifestyles, and type 2 diabetes typically involves about 90 to 95% of the cases of diabetes. There's also two others that we aren't going to go into too much, but there's gestational, which occurs during pregnancy, and then there's prediabetes, which are raised blood glucose levels, but not enough to be considered diabetes. This comes with a heightened risk of type 2 diabetes, but you can still prevent or delay the arrival with physical activity and lifestyle changes.
All right, with type 1 diabetes, when considering physical activity with type 1, insulin doses and administration become extremely important. Physical activity is still able to improve overall fitness in type 1 patients. With a sedentary lifestyle, the person with type 1 diabetes could really become even more unhealthy and lead to more sickness, which can be a higher risk or a low risk for type 2 diabetes. It's important for people with type 1 to figure out a healthy balance between physical activity and their appropriate insulin. Type 1 Those with type 1 diabetes, insulin requirements play a huge part when it comes to physical activity. The way a patient receives insulin can have a huge impact on this. Also, one must consider the way a person's individual body reacts to physical activity and how they will affect insulin requirements. Physical activity benefits aren't all clear right now at this point, but physical activity levels can help keep a type 1 diabetes patient in shape, but it can also affect insulin doses and interfere with insulin administration techniques. It will be important to find out how to link physical activity with all of the insulin administration techniques. With type 2 diabetes, at low risk, it's a less amount of physical activity needed to maintain or to not make, diabetes worse in this case. High risk, people will have to adjust their physical activity and also monitor that closely. Most prevalent cases usually include obesity and things of cardiovascular disease. Family history is also important because it can impact the amount of physical activity a person may need. Type 2 diabetes can be prevented with the right amount of physical activity. There are factors of predisposition, but if a person lives an active lifestyle, it can reduce prevalence. Family history that includes type 2 diabetes can also be related to families of lower fitness levels. Those with a higher body mass index, higher insulin resistance, and reduced physical fitness. There can be family history that impacts the amount of physical activity a person must take part in to see effective results, depending on the person's predisposition of the amount of physical activity needed to change. If a person has a low risk, the amount of physical activity needed is not as high. Even those without physical activity, the person's risk will be low. Those who are high risk need to watch physical activity closely and may need to adjust the physical activity to lessen the chances of developing type 2 diabetes. There's a lot of uncertainty of when it comes to type 2 diabetes. There are many questions surrounding a genetic predisposition to the disease and how much it contributes to a person getting it. For further research, it will be interesting to see what the correlation between the two is.
As for types of physical activity, we know that physical activity is just movement that requires energy, and exercise is planned and structured movements. However, there are different types of physical activity. So aerobic is basically repeated and continuous movement of large muscle groups. Resistance training are exercises with weights or bands that can make movements more difficult to complete because you're using that extra weight or resistance. Flexibility training improves range of motion around the joints. Balance is good for your stride, how you walk, and it's good for preventing falls, obviously. Tai Chi and yoga combine flexibility, balance, and resistance. So that is a really good way to incorporate all these different types of exercise. As for experiments, the first experiment is about the barriers to physical activities for patients with type 1 diabetes. So the purpose of this experiment is to determine those barriers. There were 100 adults that participated, and basically every time that they walked into their appointments, they would take a questionnaire. It was 44 questions. Data was analyzed, and Pearson's correlations and students' t-tests for independent samples were performed to determine relation between various factors and perceived barriers. And the results actually came back that the strongest barrier to physical activity was the fear of hypoglycemia, which is having low blood glucose or low blood sugar. Other strong barriers included work schedule, loss of control over diabetes, low level of fitness. It's ironic, however, because the number of severe hypoglycemic episodes the year before the survey was completed was significantly associated with the fear of hypoglycemia. So the people that are scared of getting hypoglycemia because of physical activity are the ones that are most likely going to get it just because they're worried about it. As for practical application, barriers are the things that stop us from doing something. So in this case, physical activity. The strongest barrier is the fear of low glucose levels, which make them most likely candidates to have hypoglycemic episodes, indicating that stress levels are a major factor. In order to fight these barriers, we need reasons to fight them. According to the health belief model, a person must decide that the benefits of physical activity must outweigh the consequences. So a therapist or a personal trainer might be best to push patients to performing physical activity. My second experiment was the interrupted sitting, which was performed with those with type 2 diabetes. And this was to find out if prolonged sitting improves postprandial cardiometabolic risk factors in adults with type 2. There were 24 inactive, overweight, or obese adults with type 2 diabetes, and this was a random crossover trial where subjects received a sequence of treatments. For 8 hours apiece on 3 separate days, there would be one control, which was interrupted sitting or uninterrupted sitting, where participants sat upright in a comfortable chair with minimum excessive movement. There was another factor where they were sitting for a half hour with 3-minute bouts of light intensity walking every 30 minutes. So again, participants stood every 30 minutes and lightly walked for 3 minutes on a treadmill and returned to the seat. This would happen 12 times over the 8 hours. And then lastly, there was a time where they would sit for 30 minutes, and instead of 3 minutes of walking, they would do 3 minutes of simple resistance activities, or SRAs. These were half squats, calf raises, gluteal contractions, knee raises, and they would do this every 30 minutes. Each exercise took 20 seconds, and they would divide that 9 times to last over the 8 hours. The results were that both light walking and SRAs significantly weakened IAUCs for glucose, insulin, and C-peptide. The IAUCs for triglycerides were significantly weakened for SRA, but not for LW, for light walking. The practical application is that 9 to 5 desk jobs can take this study to heart because they're seated for most of the day, including their lunch. My colleague recently installed a standing desk in her office to keep her muscles physically active to avoid being sedentary throughout her job.
And I did the last 3 experiments up here. I'll run through a little quick with the purpose and the results. With the purpose of the physical activity and prevention of type 2 diabetes, the purpose of this one basically was to get the effect of physical activity on the risk level of type 2. And the results of these was the moderate aerobic physical activity greater than or equal to 2,150 minutes a week was significantly associated with decreased risk in type 2, which is positive. And the practical application here is basically to pass info about this and effect of physical activity on the risk levels to patients and implement this in their own physical activity in their daily lives. What are the health benefits of physical activity in type 1 diabetes, which was a literature review? The purpose of this was basically how physical activity affects type 1, basically. They used Medline and different articles that came up in the search. These articles included the results for each outcome that was analyzed. In the first table, there was one table that indicated the quality of physical activity benefit on the selected outcome, and another figure that outlined the benefits compared with those at type 2 diabetes. The results basically showed that physical activity overall improve the fitness in patients with type 1, which is positive. The practical application basically was to apply appropriate fitness regimens for patients with type 1 diabetes. Again, with type 1 diabetes, proper physical activity and dose administration is real critical. Now, the last one that I did research on, a family history of diabetes is associated with reduced physical fitness and the prevalence, prediction, and prevention of diabetes. The purpose of this was to look into how family history of type 2 affected factors causing type 2 diabetes. As it's seen more genetically, that people think that if your family was to have type 2 in the past, it was more prevalent for you to get it coming in after them. Here, there were 5,208 Western Finland residents from the ages of 18 to 75 who filled out questionnaires and did a 2-kilometer walking test and the OGTT measurements of insulin and glucose. The results here was basically the family history associated with 2.4-fold risk of diabetes and lower physical fitness. And the practical application here have those with family history should usually go under stricter physical fitness regimens.
As for recommendations, for physical activity in those with type 1 diabetes, physical activity is beneficial and recommended to all. Blood glucose responds to physical activity different depending on the activity type and the timing, and it requires different adjustments to that. When it comes to type 2 diabetes, daily exercise is recommended to enhance the insulin action, but it differs between adults and youth. As for youth, you want them to meet the same physical activity goals set up for every other youth out there. As for adults, they should perform both aerobic and resistance training for optimal glycemic and health outcomes. When it comes to type 2 diabetes and physical activity, you don't want to allow more than 2 days to elapse between sessions. Lifestyle interventions include more than 150 minutes a week of physical activity is recommended to prevent or delay the onslaught of type 2 diabetes, where the population is at high risk with prediabetes. The same with dietary changes, resulting in 5% to 7% weight loss. As for gestational, pregnant women with or at risk should engage in 20 to 30 minutes of moderate intensity exercise on mostly every day, if not every day. Physical activity and exercise should be recommended and prescribed to everyone with diabetes to manage glycemic control and overall health, but the recommendations have to vary depending on the type of diabetes, the age, the gender, the activity done, potential complications. It should be tailored to meet the needs of every single individual. All adults should decrease total daily sedentary time and break up sitting with frequent bouts of activity, as we found from one of the experiments. And behavior change strategies can promote the adoption and maintenance of lifetime physical activity. As for future assessment, we hope that we can find quicker discovery of prediabetes. In the National Diabetes Statistics Report published in 2017, they found that 33.9% of adults 18 and over in the U.S. were having prediabetes based on their fasting glucose level, and almost half of the U.S. population 65 and over had the same thing. About 11.5% were aware that they had prediabetes. When it comes to less undiagnosed cases of diabetes, in that same report, 7.2 million went undiagnosed. I don't know how people can be undiagnosed, or that we know people are undiagnosed, but that there's 7.2 million of them out there. And lastly, more awareness of healthier diets in the affected areas. Those with diabetes, or those reported to have diabetes, included 26% of those overweight, 43.5% of those obese, and 17.8% of those with severe obesity.
And the discussion we came up with, the first one, what are some environmental causes of type 2 diabetes and how can they be prevented? Number 2, what is the strongest barrier to physical activity reported for those with type 1 diabetes and how do you think we can help them overcome it? And the last one, number 3, what is the difference of the role of physical activity in type 1 diabetes and type 2 diabetes?
Here's our reference list, and lastly, our chart. Thanks for listening, guys. Hope you enjoyed it.